to this presentation on hazards of radiation. Hazards of radiation refer to the harmful effects that ionizing or non-ionizing radiation can have on human health and the environment. Examples of ionizing radiation include gamma rays, X-rays, alpha particles, and beta particles. These ones have high energy. And then we also have examples of non-ionizing radiation, and these include radio waves, microwaves, infrared radiation, visible light, UV radiation. And these ones have lower energy. You can read further. Then we have definition of medical radiation exposure. The International Commission on Radiological Protection, ICRP, has defined exposure to medical radiation in the following three categories. So we have category number 1. That is exposure of individuals for diagnostic, interventional, and therapeutic purposes. So we can say patients. Then number 2, we have exposure incurred knowingly and willingly by individuals helping either in the hospital or at home in the support and comfort of patients undergoing diagnosis or treatment. So you can have the caregivers, relatives, etc. Then number 3, you have exposure incurred by volunteers as a part of a program of biomedical research. So volunteers during research. Studies have revealed that the major target of radiation is the DNA. And the biological effect of radiation is strongly influenced by DNA damage and also repair after irradiation. And radiation will cause ionization of the atoms all the way up to the whole body. This slide shows the importance of DNA. DNA provides the code for the cell's activities, while RNA converts that code into proteins so that you end up with normal cellular functions. But now when DNA is exposed to radiation, you'll end up with DNA damage, and then there will be stoppage of cell proliferation, and you end up with DNA damage. When there is no repair, you get cell death. This slide shows the effects of radiation on the human body. So you have the somatic effects and also genetic effects. So under somatic effects, you'll have the acute effects like erythema. That is reddening of the skin characterized by those red patches. You can have also hair loss. Then you can have effects on the embryo and fetus. And you can have the late effects such as cataracts, cancers. Then under genetic effects, you can have congenital anomalies. We've already seen that radiation can actually cause cancer. So radiation, just like any other chemical substance or other viruses, has the ability to induce mutation. And therefore, the mutations in the somatic cells will increase the chances of one getting cancer. So mutations in the reproductive cells increases the risk of cancer. And you can also have hereditary effects. So radiation hazards are generally divided into, we've already seen that you can have somatic effects. Yeah, these are effects on the exposed person. You can also have genetic effects. Those are effects on the future generations. Talk of congenital anomalies. They can further be classified into deterministic effects and also stochastic effects. Main hazards of radiation. So you have the somatic hazards. And these are the ones affecting the individual exposed. So we have acute radiation syndrome that is characterized by those symptoms. You can also have local tissue damage, eye damage, infertility, and cancer induction. Number 2, you have genetic hazards that is affecting the offspring. So mutations in the germ cells lead to congenital malformations, hereditary diseases, developmental abnormalities that will notice them in future generations. You can have teratogenic effects. Those are effects on the developing fetus, whereby you'll end up with intrauterine growth retardation, microcephaly, childhood cancers, and you can also have spontaneous abortions. Then you also have environmental and occupational hazards. So on the environment, you can have contamination of air, water, soil. Yeah. You can also have occupational exposure to radiation during radiology, radiotherapy, and for those people who work in nuclear plants. This slide gives us a summary. We had already looked at those deterministic effects, whereby the severity increases with dose. And then stochastic effects, there it is just probabilistic, there is no safe threshold. If you want to remember the hazards of radiation, you can use this mnemonic, that is cancer G. So C stands for cataracts, whereby there will be eye damage. A stands for acute radiation syndrome, that is characterized by nausea, vomiting, and marrow failure. N stands for neoplasia. So you have cancers, leukemia, etc. Then another C stands for congenital defects. There you'll have genetic mutations and malformations. E stands for epilation. There is hair loss, and also you can have environmental contamination. R stands for reproductive damage, whereby you'll experience infertility, sterility, and fetal effects. G stands for growth retardation in fetus. So you can end up with teratogenic effects. We look at radiation safety measures. Here we use ALARA principle. ALARA stands for as low as reasonably achievable. So time, distance, and shielding are the 3 basic protective measures that are very, very important. For time, minimize the time that you're exposed to a certain type of radiation. Distance, double the distance between your body and the radiation source. Shielding, use protective barriers, use absorber materials. So for gamma rays, you can use lead, tungsten, and concrete. Those ones are effective at shielding against gamma rays. Then plexiglass or aluminium is good for beta particles. Apart from that, you have to wear PPEs, personal protective equipment, gloves, aprons, and also eye shields. Then you should have radiation monitoring devices. Yeah, those dosimeters can actually be worn by workers to track exposure. And then always train or get trained if you are the staff working with radiation. So education and training, regular training of workers in radiology, nuclear plants, and also laboratories is very, very important. Then we have a question here. State the precautions to be taken while handling and also during storage of radiopharmaceuticals. So you'll just go through them. Some sample questions. Briefly explain the hazards of radiation. Number 2, the 3 basic protective measures are dash, dash, and dash. Number 3, state the precautions to be taken during handling and storage of radiopharmaceuticals. Number 4, what does ALARA stand for? Number 5, which material is used to block A. Gamma rays, B. X-rays, and C. Beta particles? Thank you for your attention.